Loose skin after tummy tuck. This is what some of our patients ask us. Now, why does this happen? Loose skin after tummy tuck. Generally, after tummy tuck, one expects that the skin is completely removed and the abdomen is flat. But sometimes in some patients, what happens is the patients may be having their stretch marks extending even beyond the level of the navel or the umbilicus. So in such cases, when this plastic surgeon actually does the tummy tuck, you still have the stretch marks in the lower part of the abdomen, thereby contributing to a sag. So this can actually show up as sag because the skin loses its elasticity in this part because of the stretch marks. So you cannot remove the skin completely and some part of the stretch marks is left. That's the reason why you tend to develop a little bit of laxity. The other reason why you develop this laxity is also because of the underlying fat which can contribute to the hang. So a thorough liposuction would actually prevent this problem from happening. So loose skin because of stretch marks and also because of laxity because of fat excess. A lot of our patients want to know whether tummy tuck can be combined with a C-section. This is not the right time to do the tummy tuck because C-section in itself is a state where there's a lot of hormonal surge. The progesterone is actually high, the estrogens will be high. So all this can cause thromogenic state, which means that the blood clotting capacity is very high, especially during the delivery. So as plastic surgeons, we would desist somebody from undergoing a cesarean section to have an additional tummy tuck procedure. Now, when this is best done is to wait for at least a year after the C-section, when all the hormones, when all the hormonal levels come down and when the patient is actually recovering from the effects of pregnancy. The skin should also be given time to retract. You see, it takes at least around 3 to 6 months for the skin to retract, and then you can have an assessment as to what's going on, and then she can plan to have a tummy tuck after a year after C-section. Some of our patients have had a previous tummy tuck and a liposuction, and they're not sure whether they need another tucking of the muscles. So in such patients, what we do is we run a CT scan and we see whether there's any divarication, which means there's any excessive sagging in the midline, which can be actually tightened. Now, this can also be felt clinically when we examine patients. We can actually, when we are seeing the patient, we see that the fingers, when we are examining, are actually dipping in between the strap muscles of the abdomen and giving us an idea that there could be a divarication. So, despite the fact that there was a previous tummy tuck done, probably it must have not been repaired. But if there's a divarication, there can be some amount of pain, which is why patients seek correction for this. Yes, after confirmation with the CT scan, we could probably do the divarication repair. Normally, these kind of problems cannot be addressed by exercises because it's not a problem which can actually dissolve, melt. This has to be physically repaired, anatomically it has to be repaired so that the abdominal muscles are tight. A lot of our patients, they come from overseas, they come from other states, and the frequent questions we are asked is, when can they travel after a tummy tuck? Now, as far as surgeons are concerned, anytime after 2 weeks, probably it's a safe time to travel because the first 2 weeks, the patient is actually having a healing wound, and we would like absolute rest for that particular area, of course within the confines of the home. But for travels, at least 2 weeks and later, we could probably allow our patients to travel after a tummy tuck.